ABVX has had a big move. The stock is around $144.65, up about 42% over the past month, helped by renewed excitement after the latest Obefazimod safety data. So the obvious question is this just biotech momentum, or is the drug actually big enough commercially to matter? That is what I wanted to check with this chart. This is a sales landscape for ulcerative colitis and IBD drugs. The reported products here shown using quarterly sales in USD billions. The ABVX row is different. Obefazimod is not generating this revenue today. That red dash bar is a scenario, roughly $4 billion in annual peak sales, converted into about $1 billion per quarter. So instead of just saying big market, this chart asks, where would a $4 billion Obefazimod case actually sit against real IBD drug sales? Start at the top. Skyrizi is huge here, at about $4.48 billion for the quarter. Rinvoq is also much bigger, at around $2.12 billion. So this is not a chart saying Obefazimod is the next Skyrizi. At a $4 billion annual estimate, it is clearly not in that top tier. That matters because some biotech discussions get too carried away. Not every successful drug has to become the biggest product in the category, but the other side is also true. At about $1 billion per quarter, Obefazimod would not be a tiny asset either. It lands somewhere in the middle of the IBD revenue map. Not Skyrizi, not Rinvoq, but not irrelevant. That is the more interesting framing for ABVX. The debate is not really, will this become the biggest IBD drug? The better debate is, can Obefazimod become a serious mid-pack IBD product? Because in this market, mid-pack can still be a very meaningful commercial outcome. Look at the area around the estimate. Tremfya is about $1.61 billion for the quarter. Entyvio is around $1.31 billion. Humira is about $0.69 billion. Stelara is about $0.66 billion. So if you believe the $4 billion peak sales case, Obefazimod sits closer to this middle zone than to the very top of the category. That is why I think this chart is useful. It gives the ABVX debate a commercial anchor. The real question is what the right comparison should be. Is the better comparison Entyvio because of IBD positioning? Is it an oral drug comparison because convenience matters? Or is Obefazimod different enough that there is no clean comp? That is where the discussion gets interesting. The stock has already moved a lot. Up over 40% in a month is not nothing. So now the market has to decide how much of this commercial case is already priced in. My takeaway is simple. The $4 billion peak sales estimate does not make Obefazimod look like Skyrizi or Rinvoq. It makes it look like a potentially meaningful mid-pack IBD asset. And for ABVX, that may still be enough to matter. The question now is whether the safety data, phase 3 profile, and commercial positioning justify that kind of expectation. That is the debate I wanted to ground with this chart.